So good evening and a warm welcome to all the dignitaries present here. I'm Sreushi from Clanet, serving as the allocated session assistant to ensure a seamless experience. Clanet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Clanet serves as the digital partner for this event hosted by the Indian Society of Anesthesiologists, Visakhapatnam, and the focus of today's session is mentorship in anesthesiology. So let's begin today's session, for which I'd like to invite Dr. Praveen Kumar sir to take over. Over to you, sir. You may proceed now.
On behalf of the Indian Society of Anesthesiologists, Visakhapatnam City branch, I extend a very warm welcome to all of you to our monthly webinar on a truly meaningful theme, mentorship in anesthesiology. Before going into the proceedings, as a tradition, let us start with a prayer song. Vignesh? Yes.
सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा पद्मपत्रविशालाक्षी पद्मकेसरवर्णिनी नित्यं पद्मालयां देवी सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा.
May I now request the President, City Branch, Dr. K. Aparanji Madam, to give her introductory remarks.
Good evening to all. On behalf of ISA City Branch Visakhapatnam, we welcome Dr. Sukminder Singh Bajwa sir, Honorable Secretary ISA National, to deliver lecture on mentorship in anesthesiology. Thank you, sir, for accepting our invitation. I also welcome our moderators for today's session, Dr. Kuchela Babu, past President ISA National, Dr. K. Srilakshmi, Professor and HOD, Department of Anesthesiology, Andhra Medical College, Dr. Durga Prasad, President-elect ISA AP State. We also welcome all the faculty and delegates participating in today's session. Thank you.
Mentorship is a bridge between experience and enthusiasm. It is through the guidance, support, and encouragement of our seniors that young anesthesiologists gain confidence, shape their careers, and develop into better professionals and also human beings. We are indeed privileged to have with us today Dr. Sukminder Singh Bajwa sir, Honorary Secretary ISA National, Dean Maharishi Markandeshwar Medical College and Research Ambala. Sir is a respected academician, a prolific contributor to anesthesia literature, and above all, a compassionate mentor who continues to inspire anesthesiologists across the country through his knowledge and leadership. We are equally fortunate to have eminent panel of moderators today guiding this evening's discussion. Dr. Kuchela Babu Garu, past National President, ISA, who is a guiding light for ISA Visakhapatnam and ISA AP and mentor to many. Dr. K. Srilakshmi ma'am, Head of the Department, Andhra Medical College, a good academician and an ardent PG teacher. Dr. Durga Prasad sir, former Commissioner, Andhra Pradesh Vaidya Vidhan Parishad, President-elect, who has got tons of administrative and clinical experience. We are also joined by other eminent leaders today. We thank all of them name by name. With this, I now hand over to the moderators. Dr. Srilakshmi ma'am, would you please read the CV of Sukminder Bajwa sir?
That's not required, please. Madam,
Yes, sir.
it's not required.
Yes, sir.
It's required, sir. Thank you, Praveen. Good evening, all. I welcome Dr. Sukminder Singh Bajwa, who is a distinguished motivator to all the postgraduates with his audacious and inspirational speeches. He is MD. Added on that, he is Master in Business Administration and FACE Emergency Medicine. Presently, he is the Dean, Maharishi Markandeshwar Medical College and Research, Ambala. He is the Honorary Secretary, ISA National, Editor-in-Chief, Practical Evidence and Anesthesia Knowledge, Editor-in-Chief, ISA Newsletter Paper, and also Associate Editor-in-Chief, Journal of Anesthesia and Clinical Pharmacology. He is the past Associate of Editor-in-Chief, Indian Journal of Anesthesia, and ex-Editor-in-Chief, Northern Supplement of ISA and IJA. And over to you, sir.
Thank you, ma'am. Thank you for this generous introduction. Actually, for me, it's always very embarrassing when people senior to me reads my profile. This is a quite a norm now, but I think after getting so much embarrassment, I'm used to it now. So I always say when you get embarrassed so many times, you become more empowered to tolerate it. So anyway, thank you very much, ma'am. And Dr. Kuchela Babu, our past ISA president. So I was a GC member at that time. I remember him very much as a president during my tenure as a GC member. So we had a very fruitful discussion and decision making in the governing council, right from the collaboration with the, I think, anesthesia editor from UK. There were so many things which we were used to compile together, but somehow didn't materialize because of some logistic issues. Dr. Praveen asked me the topic for discussion in this webinar for the especially for the Vishakhapatnam city branch. So I asked him what you really want actually, ma'am, because in academics, whatever we prepare, I think that's a usual norm. Uh, at this age, at this stage, we can develop on any academic attribute of our specialty in whatever way we can. But what does it will have an impact on the listeners and audience, especially the postgraduates. So I was thinking myself and Dr. Bala Venkat. So whenever we are speaking now, we don't go to the academics, rather encompassing the whole nation, where we should have a reach to every postgraduate or the just pass out PGs or maybe senior resident or young APs, where we can have our own impact to bring them into the mainstream so that they can go higher into the academics, research, administration, as well as in the clinical science. So I told Dr. Praveen that the ideal topic is mentorship because this is how we proceed forward and this is how we really have a larger impact on our specialty rather than speaking on a selected particular precise topic that may not serve the purpose because our country is full of good academicians. There are better academicians than me in the entire country and they can touch the topics. But sitting at this seat, as well as administrative seat of a director principal of a college and the national secretary at the same time, I think it's my privilege to be speaking at this platform of Vishakhapatnam City Branch webinar. It's not just a city branch, I think Vishakhapatnam is a bubbling branch throughout the country, not today, not yesterday, but for many years. It has produced many presidents of ISA, including Dr. Kuchela Babu sir. So coming to the topic, I think this is a topic close to my heart also because over the years, whenever I have tried to progress, this is a topic which I always love to have in my kitty, in my brain, in my mind, in my heart. The mentorship and teaching in anesthesia, leading the next generation. So what we have done, the first step in this thing is in any conference of ISA, especially the national conferences of ISA like ISACON, now going to happen in Raipur, we had made a decision, a very big decision, that 30% of the population will be of the young anesthesiologists. That is less than 40 years. I think this is a major decision. Whatever we have seen over the decades, especially when I was growing into this fraternity and specialty, I always used to see the seniors speaking on the stage, and we used to listen them very carefully that what they are saying, is it really practical, feasible, or is going to have impact on our life. Then I realized that many of our own youngsters, not exactly youngsters, but the people around between 40 to 50 age, they are better accomplished as a speakers, as a clinicians, as a trainers, or as a mentors, because they have got a both advantage of both the worlds, the previous of ether era and the new era of propofol, etomidate, and tiva tci, whatever. So I thought these people are the best, going to be the best mentors in the future generation, because anesthesiology is an ever evolving specialty in the modern medicine, which has got its date of birth registered in the history of medicine, 16th October 1946. No other specialty has got its date of birth in any part of the country or in any part of the globe. So this is a science which really requires a lot of teaching, a lot of mentoring, and one has to keep a pace with the rapid advances in this specialty, because it imbibes the knowledge from all the clinical branches: medicine, surgery, gynae, ENT, eye, psychiatry, medicine. Wherever you name any branch, we were all there. You have a NORA, you have emergency medicine, you have a critical care, you have a pain, apart from your basic anesthesiology. So teaching and mentorship in this specialty is very, very important, because no other branch may have the mentors of that much caliber which can teach so many wings of a specialty. So that's the reason for choosing this topic. I thank Dr. Praveen for accepting this proposal, and let's go with the topic. Now, mentorship and teaching. The basic idea is leading the next generation. That is empowering the individuals, I will say the young individuals, fostering growth of academics and science among them, and shaping India's future through impactful guidance. On the record, I can say this thing, that we always, when we growing up, during our time, we always used to see the ASA guidelines, the ASA advisories, formularies. Now, it's the first time in the history of ISA that the ASA themselves approached the ISA, and we signed a MOU with them for sharing all the academic knowledge, webinars, and so many other things, including the conference matters. So that is a historic step where ISA approached the ISA. Now ISA is almost the fourth active branch, active country in the ladder of WFSA after USA, Germany, and China. We have even defeated the Britishers to come to this level. So our aim is how to create a more leadership domains among our coming generation. That's very, very important, and that's the need of the hour also. And if you ask me about the mentorship, I think is the national government of India has also come with a national education policy with so many of the objectives, and why the mentors are important nowadays. And even in the NMC, they have started the mentor-mentee program. How useful it will be, I don't know, but at least the initiation is more important. And later on, how we really find the results or analytics, that's the thing we can see later on. But at present, we are building upon this gaps where a good teacher, a good mentor is very important, because during our growing up in the schools and in the specialty, we saw that out of 10 teachers, we used to listen only to 3, 4, not to the rest of the 5 or 6. The reason being very simple. In a medical college atmosphere, everybody does not grow up with the same attitude, same magnitude, same status, same skills, same knowledge, same wisdom. So, only the best people who grow up in a holistic manner in a medical college, we imbibe our knowledge from those people, and then we really going to become a good anesthesiologist after passing out a PG. So the national mission has already encompassed, they have already formulated a site also, website also. I think these are the programs which give us stimulants to the different specialties, organizations to come up with a varied level of the program so that the mentor-mentee relationship is established and we may bring out more good teachers as well as mentor in the future, and that will definitely going to enhance the reputation of the country, the growth of the country, the academic growth of the country, as well as and on other aspects also. So broadly speaking, mentorship in medicine has been increasingly recognized as a core component of training and career advancement in academic medicine. Coming to the mentorship definition, do we really understand the word mentor in true sense? I think it's a word which has been imbibed in literature, conveyed to us by various people, agencies, the government, that a mentor is a person who shapes up the person. So they may look at the person as a person is a mentor. No. If you introspect yourself, I think when you grow up, right from a childhood to this level, mentorship encompasses almost every circumstances which we encounter during our growth, every adversity, every opportunity, every hurdle or barrier, every encouraging pat. So all these factors in totality, they act as a mentor to us. So the mentor is basically a summation of all these factors rather than just merely a person. A person may be standing in front of you, maybe associated with you, related to you, interacting with you daily. That doesn't mean that person is going to shape up you. You are good to get influenced by so many factors. The person may not be responsible for all these things. So in reality, the mentorship encompasses a big a big area, a big horizon for the inclusion of so many things in its ambit. So do we need what's the need of having this mentorship in our specialty? Because in our specialty, if you everybody knows that after 3 years of your residency as a postgraduate in anesthesiology, either you go on to become a senior resident or you're going to become a worker in a corporate setup or you start doing the private practice. But when you do these things, you're the most responsible person. So somewhere in your department imbibes that quality in you. As I told previously, out of 10, maybe one or two. You may not be listening, you may not be giving attention to everyone, but you will be giving attention to one or two people whom you think they are the good people, they are responsible people, whatever they're telling is logical and very, very important for a growth in our specialty. So imbibing a responsible attitude because you're going to deal with the patient directly after your post-graduation. No other specialty deals with the game of life and death after your post-graduation. If you talk about a surgeon, even if he's doing a private practice, he will never be allowed a free surgery or people may not come to him immediately because people go to those people who are established. The beauty of branch is we don't require a name for establishing ourselves. It's our golden period. from 30 to 40, where you can practice, where we can do a senior residency and APship, and where you can be in a junior to senior consult in a corporate setup, where you develop your own identity. And during that time, you earn money growth, and you live a very peaceful life as compared to other branches where people really struggle to make a name for themselves. Even a physician, MD medicine, if he thinks that he has done MD medicine, it takes time for him to compete with the people of alike, the senior people, because people always go to the clinician of white beard, white hair. That's what normal in our life really occurs. So it imbibes a responsible attitude. So that means this specialty really requires good mentor, that we should be responsible because we are going to deal with very, very important situations after post graduation. Important is the quick decision making. So many times you encounter the difficult airways, the failed spinals, the severe anaphylaxis, traumas, so many things are there. In these situations, you have to make so many quick decisions. How? Nobody comes with a wisdom from the womb to make quick decision. Even in your 3 year postgraduate career, you learn this decision making from your mentor. Otherwise, it's a very difficult for a person to have quick decision. But what we are taught in our post graduation in any medical college of our nation, we develop this skill of quick decision making, and that's what sets us apart from other specialties. This is very important, and it cannot happen if we do not have direct or indirect what you call mentors in our life during our post graduation. Discipline. The discipline is first and foremost, right from the pre anesthetic checkup to the intraoperative monitoring. You have to be a disciplined person. Any negligence or ignorance on your part will definitely lead to the poor prognosis for that patient. You may lose a patient. That's what I say about discipline. Again, these type of habits, whether you learn from a second year or a third year resident, when you're a first year, or you learn from the senior residents or the APs, associate or professors, but you learn these habits from our seniors only, or sometimes the mentors, you call mentors only. The communication skills. I think nobody can be a better communicator than an anesthesiologist. Medicine, psychiatry, surgery, derma, they may be encountering everyday OPD. Those skills only enhances their clientele. How to give more patients, the quantity, the quality also to some extent. But when you are working in ICUs, critical care units, or when you are having the severe cases in the operation theaters, how you really communicate with the relatives, how you take consent, how you really break the bad news. These news you cannot deliver unless until you watch someone, you learn from someone, you imitate someone. These are the communication skills which come from a mentor only. So, as I told, mentor is not a one person. The circumstances, these are adversities, these are the people around us who teach us these things. The communication skills of an intensivist, oblique anesthesiologist are the best in the world. No physician or clinician can have a better skills because telling a body is going to live for eternity. Nobody is going to take that lightly. But how you explain it, that is very important. So this again a mental skill. Yes, in doing so, we have to be very ethical. With nowadays with the CPA, the Consumer Protection Act, the stakes are very high. Anybody can sue you, anybody can pursue you. So you have to be very, very careful and meticulous while dealing with such patients, whether in the operation theaters high risk ASA4, ASA5, even ASA3 patients, or even in the ICUs also. The ethical aspect and stakes are very high. Who is going to teach you? Your own seniors. Or you may follow your mentors. There is never a single mentor in anesthesiology. This is my opinion. Don't make it rubber stamp that it's opinion of everyone. I've never seen a person perfect enough in anesthesiology who can teach everything in anesthesia or critical care or pain or emergency medicine. It's always a team. Everybody has got their strengths and weaknesses. So you remember those things which are strong, which you should be imbibing in your career. And the daily incidents in operation theaters and ICUs, difficult airways, failed intubations, difficult cannulations, collapses, cardiac arrest, so many things are there, both in ICU and operation theaters. How you deal with them? Do you think that you can get these things by learning, reading books, or a classroom teaching? No. These come by demo. There's a famous Chinese proverb which I read during my first year in 1992 in my dissection hall. It was written on the wall of a dissection hall. It was like that: I hear, I forget, I see, I remember, and I do, I understand. So, the more incidents you encounter in operation theater and ICU, you learn more in an accomplished way. And that makes you a very perfect anesthesiologist, oblique intensivist, oblique resuscitator. That's why, if you believe my words, in NMC in 2013-14, after the amendments, emergency medicine was introduced for the first time. And the only branch in entire India, they believe that this is the branch which can handle this emergency medicine is the anesthesiology. Even the government realizes this thing that no issue can be solved without the involvement of this branch. Why? Because this branch is full of mentors. It's associated with the branch, or it's associated with our pattern of teaching in this particular clinical profile of teaching in anesthesiology, that we are regarded as one of the most reliable and most trustable branch when it comes to patient safety. And that's why another example is the COVID. Half of the patients in entire country, entire globe, were handled by the intensivist and anesthesiologist. So you could imagine, if we would not have given weightage to the clinical care during that time, almost 15 to 20% of the population in the entire globe could have been wiped out. We are the one who became COVID warriors, put our faces, dealt with adversities without caring anything. Many times seniors were spared for going to the ICU, but in private hospitals, in private setups, even the seniors were not spared, that you have to take care of these patients. But that was a time when we really learned that we are the people who can handle any emergency across the globe. And we are united, we have the same feeling, we have the same teachings. That's how our branch goes. That's the essence of mentorship in this clinical specialty. You can't say the Miller is the best mentor. You can't say the Stolting is the best mentor because they have written the books. You can't say Jon Snow was the best mentor. But the branch encompasses such good qualities and domains that we are privileged enough to be a part of this branch. So this is my opinion again, but I think many of you will be agreeing with me on this aspect. Now coming to the qualities and attributes. Now I will be asking the question on the behalf of postgraduates. They may not be asking me the question directly. Dr. Praveen, if somebody asks a question, you can interrupt me. You ask that particular question at that particular time so that
Okay,
we
sir.
should be answering them.
Okay,
It
sir.
should be interactive.
Okay.
Can we classify the mentors? I think it's the most difficult question for me. We cannot classify. The reason being very simple. To each of his own. Every anesthesiologist, every intensivist has their own goods and bad. Even after imbibing the same knowledge, after getting through the same examinations, everybody has got a different skill sets, different clinical wisdom. So it's very difficult to classify the mentors and also according to the needs, the teaching pattern, the communication pattern, it's very difficult to classify. I am just asking the question on behalf of the postgraduates now. My things are going like that only. So next question will be by the postgraduates if they ask me what are the general expectations from a mentor? Or in other words, what qualities do we seek in a mentor? This is the most important questions. In present day world, when we see the younger generation is getting drifted from the moralities, the ethical aspects, the behavioral pattern changing with the wider dissemination of the social media things. Things are becoming difficult nowadays for teaching, as well as that Guru Shishya relationship that is also on the brink of extinction. But it also, I think, the fault lies in us also because we are not able to maintain those things over the time, due course of time. We can't blame it on the older generation or the younger generation. How really we do expect mentor to behave? No, now I'm talking about a person, not about the circumstances or adversities or learning curves or about the role models or supervisors. Here I'm talking about the person. So you are looking at a person, whosoever it is in your department or in your personal life, a person who's a mentor. What quality do we really seek in a mentor? So first of all, more important thing is we being selfish. We always seek, we always want to seek, we don't expect how we are, what we really are, but we want to seek these qualities should be in a mentor. That he should be selfless, he should be courageous, straightforward, empathetic, sympathetic, trustworthy, sincere, wise, so many other qualities, so many other attributes. Do you think it's possible for a human being to be like a semi-god or a demigod? It's not possible. We have a definition, we have a synonym that what we call is to err is human. If you are doing a mistake, that means you're a human being. Mentors do make mistakes. Nobody is perfect in the world. We try to be perfect, but we are not. We encounter almost every situation every day in our professional life, personal life, and we expect that the mentor should be teaching us right from the beginning how to deal with the situation and tell us each and every simplified solution to our problems. That's not feasible. You have to take a cue from whatever the hints, from the words of the wisdom, or from the actions of your mentor, they give it to you. You take those things into the perspective of whatever is happening to you. You know, one thing, I will give you two examples of mine itself here. Although I don't know how much good a mentor I am, but I always try to be a good mentor because I've crossed the age where I always wanted to be a good mentee. I think it's a time to give back. A very simple example. I was serving as the Associate Editor-in-Chief of IJA. Dr. Lalit was the Chief Editor, I was Associate Chief Editor. So he also was down with COVID and some health issues. I got down with the COVID along with my wife and my daughter. So it together in the HDU, three of us in the same room. At that time, being associate in chief, the mail was there, everything was there, laptop was with me, and requests used to pour in that when is my article going to get published. At that particular time, when the world was upside down for everyone, people were dying with the COVID. People, many of them still had the audacity to ask the chief editor that when is my article going to be accepted or getting fastly reviewed. Rather means it's you getting so selfish. They don't care how the editor must have been doing in the COVID times. So I came out with a very good editorial at that time. I think it's very good because that was I wrote it from my heart, editing from the dungeons of the COVID. I think that was my first editorial in that sense, where I wrote that editor is still reviewing, still peer reviewing and editing your article. In spite of his family down, his saturation was the 91, 92%. But I edited that articles, whatever articles was sent to me at that time. The second instance came, I think, in 2022, when I won that election of a secretary of the ISA National. And I took over on 25th of December 2022 from the previous secretary. And just prior to that, 12 days before, I ran a marathon of 35 kilometers. I think 13th or 14th December. I ran a marathon of 35 kilometers. I took over in 25th of December 2022. On 31st of December, I had some chest discomfort. I went to my cardiologist at night, 12 o'clock in the heart center. I was diagnosed with a 99.9% block of my left main. So he was astonished at how we surviving. But the only best part was my collaterals were grade 3. I was surviving because of collaterals, which must have developed over the last 8 to 10 years when I was doing running. It was told to me you have to undergo CABG. That's a better alternative. Stenting cannot be done. So I took my decision. Okay, why should I wait? I want to be on the ground. Was very positive. That's what a quality of a mentor is, the courage inside you, the bravery inside you. I told I want to get operated. I got operated on 6th of January. That's the birthday of my wife. So together we can celebrate the future birthdays. That was the day I decided. I got a lot of pain post-operatively with the pleural tubes and this chest tube touching the pleura and every so painful. And the narcotics you took, it was the vomiting. I had a difficult time. But at that moment, I realized I was not giving up. I was not giving up. And on getting up, I celebrated Lori also. After 7 days, it was Lori. We celebrated at my friend's place in Delhi. I got a discharge in 6, 7 days. Then, I was so desperate that I'm not a heart patient. Even during my rehabilitation in this one ward, on the 4th day itself, I was walking briskly in the corridors of Medanta. Then, after getting discharged, I was so much, preoccupied that I want to set an example, that I want to live a life because I want to set an example. It's not that I should be tied down with this thing. 30th January, it was my first brisk walking. I think hardly 25 days. 25 days I was brisk walking on my terrace, and it took me 2 months more for brisk walking before I started my first running. That means the 1st April, hardly 2, 3, almost 3 months you can say. After 3 months, started my running again. on the ground, on the roads. The comeback, why I'm saying comeback, the mentor should have these qualities. You have to have a selfless nature, sacrifice, you have to come over this thing. And before running, I had a GC meeting at 1st and 2nd April at Patna. I took that meeting, my wife went with me because it was my first visit outside my city. But it has to be done. You are leading a nation as a secretary. You are leading a nation of experts, anesthesiologists. And you think that just by undergoing a CBG, you are a secretary and responsibilities are finished? No, you cannot. I did that. I'm happy I did that. And from there onward, I never looked back. And there was a very tense election that year. I maintained a tempo. I made it clear that I'm going to conduct this election in the most neutral way. But the most unfortunate thing happened. Elections were from 1st to 5th November of 2023, and on 10th of October, my father had a brain hemorrhage. He went on ventilator. So I was taking care of him. Every day I used to take care of him and never allowed my family members to visit him because I know they will break down. During that time, what I felt is very difficult and hard for a person. But it gave me inner strength to be a mentor to so many people, mentor to so many students. You are there. I'm eating, I'm sleeping, I'm having food. So why can't I do the two functions at the same time? Many times when we have a family emergency, we don't attend to other functions. This is norm. But that time, I get on to my work for ISA. My clinical work, I used to attend the hospital also. I used to take care of my father also, find my family also. That was the biggest challenge for me in my life. And then I realized myself, yes, you are a mentor. You set an example, you can lead the world. There onwards, many people know that how the elections went, the most neutral manner. And from here only, Vijayawada, Dr. Bhimeshwar came to my place, Dr. Venkatagiri came to my place. My family attended to them, although my family was in a doldrum. They saw my condition, my father also, they went to the ICU, both Bhimeshwar sir and Dr. Venkatagiri sir. They saw the situation and they were very much amazed at how the work is being done in the headquarters as you as a secretary. So that's what I say. I'm just giving my example. At that time, I had recorded a video also of myself, but I didn't circulate because one of my closest friends said it is not good. I told that even if a doctor, if my father is on a ventilator, I'm not removing the ventilator. I'm waiting for a hope. Otherwise, people will always say that the patient is kept on a ventilator just because they want to make more money. I wanted to circulate that to make people aware about that. But that did not happen somehow because there are so many things associated with it. Why I told this story here is the quality of a mentor is the courage, selfishness, the bravery, the things to do. You have to live up to the expectations of the people around you. People may be asking very silly questions. Voting things. People asking my vote has not been cast. How to do about it? Here you are entrapped in emergencies. Even Venkatagiri saw it. My father had distressed on that day when he visited my father in ICU. On the other hand, we were getting calls, my vote has not been cast. So these stupid questions were seemingly very stupid to me. But you have to respond to everything. That's what a mentor we should be doing. The qualities of mentors, what we seek in him. So another important part is, do we choose mentors or mentor chooses us on the basis of near perfect act? It's a very important question. How you really want to choose your mentor? Do you really want to choose that? Suppose anybody from Andhra Medical College goes to Dr. Aparna or Dr. Uh, Lakshmi ma'am or to Dr. Parveen. Sir, you are my mentor. Nobody will agree. So how to choose a mentor? I'm talking about all the postgraduates. A very simple solution is you go to a senior. If you think that person can be a good mentor to you, ask him or her, sir, madam, I'm facing this situation. I would like to know how will you face this situation. This is my submission. This is how I react. How will you react? The person will definitely give an answer. Okay, you facing this situation. I like this thing. I think when you ask such type of question, you can develop more questionnaire like that. You want to, you just can't go and say you are my mentor or the mentor say you are my mentee. Nobody chooses with the willingness. It's always happened by either by accidents or by some quality attributes or by some circumstances. But if you really want to choose somebody, you have to develop your own way of choosing the mentor. It's a very, very important part. And that's how you go forward. Because if you choose a mentor, then you have to obey, you have to listen to everything from him or her. And why is the necessity and the choice? Many people, I think many of us will, in the post graduation, will say, is a necessity to have mentor in life and that too in our specialty. I am a very good person. I am very knowledgeable. I was a topper of my institution. I topper in NEET, PG. I can do my own studies. Why should I need a mentor? And the seniors in the department, they are not working properly. They are not knowing, having the knowledge, the fresh knowledge, because what we are studying and reading that is not known to them. They are not refreshed themselves. No, that's not way. The learning curve for everyone in the life is different. With time, your learning curve, your requirement changes with time. And sometimes you may not be experienced enough. You may be good in knowledge. Knowledge is not holistic thing which you will be able to exercise. You have to have somebody to teach you the real lessons of life. And nobody teaches in free. You have to give respect. You have to show sincerity to get those things to be learned from them. Do we consider the most knowledgeable person of our best mentor? This is a very common question by PG. No. I will say no to this thing. The most knowledgeable person, the most academician, the most superior editor, reviewer, whatever, he cannot be the best mentor. The best mentor is a person who has got the most adversities in life. He may be having a meager knowledge or maybe moderate knowledge, but he can be your best mentor. That's the next answer to this question. Then how do I choose my mentor? I already explained. It's a way, depends upon you, how you really develop a questionnaire, rapport, how to approach the person and get involved him as a mentor. Because every mentor will have his own self-esteem, self-respect. So you have to break that barrier and shell to go into that shell and get a rapport with him or her. Can we progress without a mentor? Yes, I say yes, you can progress without a mentor. You can progress without a mentor. But at some stage, there may be barriers, obstacles. At that particular time, you will like that somebody should have been there to help you out. My friends, my peers are not able to help me out. Where somebody senior should have been there. So many times you will encounter this situation because PG is the most protective atmosphere you are doing the post graduation. Once you get out of the PGs, you will face so many adversities when you're in a job. But if you develop a good mentor in PG, you can always rely during your post PG career that this person is the most helpful. They give the best advice to me, progress in the life. So, yes, we can progress, but not entirely. There are few people who can. Those are the exceptional people. Those are the people who going to become the good leaders of society, good mentor of society. But if you follow those people, I think self-made mentors are those self-made mentors, and it's always better to get a mentorship from those. Now, another question is just as our specialty is ever evolving and progressing at a rapid rate, do we need to change mentors at a different phases and stages of life? This is a very pertinent question. What the education was there 3 decades ago? I am talking about myself, 28 years almost into now. Yes, things have changed, syllabus has changed, a lot of medicine, a lot of things have come. No, but we not, need not change mentors. Mentor doesn't mean that they should having a fresh knowledge. Mentor means they are more important for your psyche, for your actions, for your conduct, for your career. not for your knowledge. For your knowledge, you have teachers. So it's not necessary you have to be having a change of mentors, and that is not a good sign also. A changing mentor means you are not stable person. Loyalty to a mentor is very, very important. You may not want to achieve the higher things by just, moving away from that mentor. That mentor may be feeling very bad. You may choose an inferior mentor than him just for the sake of knowledge. No. You have to be like a person. You can have many mentors, but with evolving medicine, you have to strike a balance yourself. The synonyms like are teachers equivalent to mentors? No. Teachers can only teach. They can only give you, out of 10 teachers in the beginning, I gave example, they can teach you the essentials of anesthesiology, but how many of them really turn out to be good mentors? I don't think so. And there are models of mentorship? Yes, there are models of mentorship. Like apprenticeship, like OT based learning. When you are in OT, you're having a training there. So I think it's a very mini scale. You have models there also. Then near peer means senior agent guiding juniors. This always happen in every medical college. And team based when you're going for the workshops or some simulation workshops or a hands-on skill. I think those are things faculty plus multidisciplinary team. So these are the models of mentorship. And globally, this phenomena is rising. This phenomenon is rising like anything, but I think we have got the best mentors in our country. This is my belief because what we teach with the second largest society of the world in the real numbers, touching 50,000 now, almost 50,000 now only, after American society, and how much mentorship we did, how much work we are doing in this country is immense. Its moment is a huge among us. So I think the global perspective, we are the next generation is very much prepared for all type of anesthesia procedures. The mentorship journey, I will not develop on it already. I have given my examples. So mentorship is often used interchangeably with the role models and supervisors, although labels are not equivalent. I think you can correlate with all those film heroes and with the seniors in your department, but they cannot be role models because you never believe in them to be the mentors for you. So they what they provide about the skills, the career guidance, choosing subspecialties, they can help you in that. I think this is an evolving branch. So many subspecialties and super specialties coming in anesthesia. Research mentorship, public in audits. I think I've been into this branch for the last almost 15 years now into research and audits. And I know, very honest, I have been helping more than 100 people in this thing, and few of them have gone to make a good name. They have evolved over the years. Research mentorship is very, very important. Being editor is nothing. I am a editor, chief editor. I may be doing rejecting or accepting articles, it's nothing. But how you make other people grow? You tell them that your article lacks this deficiency, you make them grow, that correct this deficiency in your article. This is the research methodology which are flaws are there. You tell them this thing. You show them the mirror. This is how you really progress in research and academics. And the leadership and resilience. After the leadership, when I became secretary, I've encountered many people throughout India about different situation, difficult situation. We started a helpline also, ISA National Helpline. We got so many responses there, so many queries there. Every day, almost every second day we get a query. I'm having this problem, the postgraduate, the senior resident, even the professors also. The coping strategies, when you discuss with them, they become so light-hearted now. That's what I've faced over the last 3 years as a secretary, that not as a leader, but as a friend. Mentor is basically a friend. How you tell them, even though you may having a very adverse circumstances at home, in your institution, personally, but when you lead with this thing, this gives you so much satisfaction. And you become a permanent relation with those things. I can name hundreds of these people in my country whom I really, have a very strong connection with after having a one-on-one communication with them regarding their problems. This is how a leadership should be. A leader or a mentor at this stage, I think as a secretary and a mentor is the same thing for me when I deal with the ISA members. This is what ISA is all about. A close family unit when it comes to the difficulties. I think Dr. Kuchela sir will agree with me that in ISA, people follow you, people look upon you, people look upon for help from you. But there are challenges in mentorship also. It's not that easy. The hierarchical structure, a professor is there. He may not allow associate professor to get a good, a mentor to a PG student when the PG student direct connection with the HODs. So these are small challenges. The limited time in busy, you are always busy in the operation theaters and so many things are there. There is hardly time for the mentorship, the gender and cultural gaps, regional barriers, the linguistic barriers are there. So many things are there. But these are challenges in mentorship, but they can easily overcome if you really, I think, serious about it. If you think about the futures, how you go about it, I think e-mentoring and online programs can be there where we can really have an online discussion the way we are having now. We can have a structured mentorship program. I don't know how will it work really because always we think of one-on-one. But how a structured mentorship, I think it is a good idea. At some stages in some society like Western society, it has a good success. In India, how will it have a success? I think may be having at some places, may not be having at some places, but I think it's not a bad idea to try for. Then AI and virtual reality stimulation support is always there. These are coming, but how useful they will be in a real emotional, structural, behavioral scenario, that is a question to be asked. So in conclusion, teaching impart skill, but the mentorships inspire careers. This is a fact. One confession from my side here is I never had a mentor. My circumstances were my mentor. My positions were my mentor. My family conditions were my mentor. My adversities were my mentor. So I told in the beginning, mentorship is not a person. Mentor is not a person. These are the other abstract things also. A good teacher tells you what to do, but a great mentor shows you who you can become. And mentorship is the torch that lights the way for the next generation. So thank you, and question and answer can follow. But I request Dr. Praveen sir to give me 1 minute. I have been getting a call from down. Just give me 1 minute. We'll continue from here. 1 minute only.
Okay, sir.
Thank you, Dr. Praveen. Actually, what happened, there was a uh, section at home. My twins were born, so some had problems, so I just guided them and came back
Okay,
now. So I hope I took a long time for this session.
sir. Sir, may I request the moderators, Kuchel Babu sir, Durga Prasad sir, and Sri Lakshmi ma'am.
Thank you, Dr. Bajwa. Your oration is very well appreciated, and by especially the mentee mentorship. That is both the how to choose a mentee to mentor, how to mentor should guide the mentee. In relationship of the mentee mentor is a very not at an easy job to anybody, but a mentor always gives his everything what he has, not of the knowledge. Knowledge is what you told. A teacher can give a knowledge. A mentor is not only a good teacher, but he'll gives in the total the life of the mentee, how to go and become a ladder steps, one step by one step, how to become a good in the society. Not only the knowledge and also cultural and quality wise, and how to have good communication skills and making a humanity good human. All these things learned from the mentor. That is without sometimes the mentor may directly involve everything. He does not tell the mentee. Mentee will absorb by observation. What you told me, everything is told, but I'm only repeating for the mentors, how the postgrads, everything. Mentee always watch the mentor, what he wants
Sir, you got muted. Kuchele Babu, sir.
to observe. Yeah. Sorry, some call came. Hello. Yeah,
Yeah,
that is a
audible, sir.
mentee. Yeah, mentee always. Mentor may not be everything he will go and tell, but mentee always. Mentee is observed by mentor's skills, knowledge, his character, so many things will get from the mentor. Like that, what the Krishna, Arjuna, how he learned from Karna, how he learned from the Dronacharya. Like that, you should always choose a good mentor. Always choose. It is in a education system also the mentor direct mentee without now that we didn't have a mentee mentor relation. So the few institutes will have a for one mentor for a 10 or for students, but some institutions only having the mentee mentor relationship, but all the institutions not there. But he is not there also. The mentee it automatically chooses the mentor. Oh, this is my guide, this is very good teacher. Not only teacher, not only one aspect, not the teaching means only the teaching, but you'll see how he observe, what is the character, how is the behavior, everything learned from the mentor. That is what is the relationship with mentor mentee. What you told is very good. That is a very good talk given by you. I think mentees, all the students will take the all these points from the Dr. Bajwa. Thank you very much, Dr. Bajwa.
Thank you, sir. Thank you very much, sir. You being one of my seniors, I always appreciated your presence in the GC as a president. Very
Yeah.
soft-spoken and very wise in taking decisions also, sir.
Okay, thank you, thank you, thank you.
Thank you, sir.
Sir, this is an excellent description of the word mentor as well as the job of mentoring, sir. You have given really a good explanation. And I think this is good not only for PG students, for teachers also it's very good. As you said, one can have many teachers, many good teachers, but not all teachers can become a good mentors because mentorship is a little higher than, and it should prepare young doctors to face the challenges in the real world. Just I want to add one thing, sir. Nowadays, you must be training many postgraduates and you have a vast experience of mentoring all these people. Well, not all are going again coming back to medical colleges, and some are going to settle in corporate hospitals, or some even may go for freelance anesthesiologist, where they are likely to face entirely different set of challenges what they face as a postgraduate in a medical college. I think they will be subjected to lot of pressures to succumb for survival. They may be forced to lower the safety precautions or even lower their dignity, which will be the start of falling. of their both, not only their own thing, it is for their colleagues and even for the specialty. So, how about inviting some good successful practitioners once in a while to the department and arranging for an interaction with the PG students? Because they know they already navigated all those challenges in life, how to deal with different circumstances.
Yeah,
I want your
true,
opinion, sir.
true, definitely true. So, we don't have five fingers equal. That's the truth, actually. You know, do we think that all the 100 anesthesiologists who pass out from an institution, do they imbibe this all same moral values what a branch tells them? No, not possible. Not in anesthesiology, in any branch, whether surgery, medicine, gynae, or whatever. When they pass out from the institution at the present capitalistic country, many of them do go for money. That's a reality. We should not hide from it. Rather than you say leading with them with an example or some private practitioner, leading practitioner, because when they are not listening to the 3 years, in a 3 year, when they have not listened properly to the teachers, to the mentors in the department, do you think that, sir, they will be really listening to the people in the private practice? In the practice also, the seniors who are there, they have to have a large heart in teaching those things or make them understand that practice is not that, it should not be practiced in that way. But I don't think so. They will listen to them also. They will say that we have learned enough. It's time for us to make money. We are more energetic, more labile. We can lose sleeps. We can do more work, hard work. We can do more running. We can earn more. Actually, the greed of the money is the sole incentive for them to run into the practice. It's only the time will tell them. You know, anesthesiology is such a branch, it will teach you at some stage of your life that money is not the entire thing, it's the patient safety, your health, and your other issues in life are important, sir. In such cases, a practitioner, even may taking a class in the institution is a good suggestion. No doubt about that. I think when we are having a discussion on 14th of October in the anesthesia week about the career opportunities. My topic is anesthesia and practice. There is a cardiac anesthesia, neuro, obstetric, pain medicine, every career opportunity in the anesthesia. We will be dwelling about in anesthesia week at this time. I have chosen the research and practice. That means institution and practice. Sir, in practice, it's the time, it's the incidence, it's the adversity which will teach you, which is going to the most important teacher for you, rather than the most senior practitioner giving his wisdom. It may be out of 10 people, 3 or 4 may imbibe that wisdom, rest may not. For them, money may still be the most important driving force in getting out those cases at a lower level, the lower rates in practice. Then bypassing the sick and then praising or what you call buttering the surgeon that you should be calling me, I will take less cases, less money for those cases. These things, sir, will keep on happening, not in anesthesiology, it will happen in every branch, sir, every branch. But we are more concerned in our specialty, sir. I think in any city, in a closed city, the most important thing is to strengthen the city branch. If the city branch is strengthened with the practitioners, with a mix of practitioners and academicians, you can have a better atmosphere where you can welcome the youngsters and they feel a part of the family. I think when the everybody in the family, they will be trying to do with the family, the unity is a bigger thing, sir. Tomorrow, anything adverse event happens, you are always there to help the person out, whether senior or a junior. So, imparting a good, inculcating a good atmosphere or a youngster to welcome into the practitioner's family in a city. Or you can have one thing, have a more frequent city branch meetings. Even after passing out in a 1 month, if you have a monthly meeting, that will make you a part of that particular close-knit family, and you can easily impart the moral standards, the cultivating standards, the practicing standards, and all the things. I think that's the only way to go forward. We cannot teach somebody by force. We cannot teach somebody by selection. It's only by setting an example in such a way, and ISA is such a platform. When you have a national body, so at a city branch, when you are holding a regular monthly meeting, maybe some part of academics, some parts of a role play, some parts of a real incident scenario, some parts where the people become helpless in a particular situation, everybody realize that it will come upon me also someday. So those are the situations, sir, which can unite us. That's the only way I think going forward, rather than just a mere didactic lecture in the sir, institution. That is just a part of the way we can help them.
Yes, there is no guarantee that they will listen to them.
Yeah,
But if the said person is a successful practitioner and also a good one, then they may take him as a role model.
yeah,
Sometimes it may
possible.
help.
So yeah,
Because
possible. That's
as
why I
you
say.
said, everybody is after money. They also suppose if practitioner is also a successful one, then they may listen to him.
That's a fact, actually, sir. We should not ignore those facts. So, money is the biggest driving force in the private practice. But I think at certain stages, sir, I always used to give a lecture on Maslow's need of hierarchy. When you have fulfilled your basic need, then you go to the next need level, and then you go to the level of self-esteem and self-respect. And after that, you go to self-actualization. That why have you come on the earth? So that's the last step. But self-esteem, self-respect, if you achieve that stage, money becomes secondary, sir, at that stage.
Yes. Thank you, sir.
Sri Lakshmi ma'am.
So thank you so much, sir, for enlightening us on the importance of the relation between the mentorship and mentee and the qualities of mentors. At the same time, how the mentorship uh, with our mentorship, the people will grow with our mentorship. And I don't know actually about the ethical aspects, but you enlightened us the ethical aspects, empathy, and he should mentor should be like a friend. And even at any circumstances, the way you reacted, all the people should take you as a role model in being the selflessness and courage, sir. And actually, uh, there are so many models of mentorship. All should take you as the role model, especially in this, say, in the bad situations like what you faced during your COVID time and your father when your father was sick. And thank you, sir, once again. You enlightened us so many extra points what the mentorship and how the mentor should be and the relation between the mentor and mentee. Thank you again, sir.
Yes, ma'am. Actually, this is a reality. Sorry, sometime the first time was spoken over the media, over the, you can say, over the channel or a webinar about those incidences. But this was important because what Dr. Praveen had asked me to do is a tough job. It's not easy to justify yourself. If you are not true to yourself, you are not honest to yourself, you don't tell your situation, because that inspires a lot of people. And in doing so, what I did, it's not because I am going to achieve anything particular by telling these things on this webinar, but that's very important for everyone to understand that every one of us, bear the adversities in life. Every one of us. It's not that I had some adversities, but when you are sitting in a position, when you're sitting in a position of a national domain, of a national society, you have to react differently. You have to sacrifice. We always keep on sacrificing our political leaders also. Say that person is very political, he's sitting on that thing, he's doing this thing. But how many things he get in a day from everyone, that this problem is there, that problem is there. We don't look at those things. We just see that he's enjoying the political patronage and that person is sitting just there for the sake of, you call the authority, power, and money. but we never know that what person is facing every day. Same thing is for the ISA also. If ISA is a very honorable job, whether it's a president or a secretary, you sit in those positions. So you take an example of Bala Venkat, he spends so much time in visiting everywhere. So you talk about the secretary, he times everywhere in the webinar or visiting everywhere. Where do we get a time? We are sacrificing our family times. It doesn't mean that we don't want to be with the family. It's always fun to be with the family, spending time with them. Now I'm taking a didactic. My son and daughter will be traveling at night at 2 o'clock for their some function in Ames Rishikesh. So I would have been spending at least 30 to 40 minutes with them now. But this is what we have to be. When you are in leadership role, in a mentorship role, you have to sacrifice. That sacrificial intent has to be there. That instinct has to be inside you to become a good role model. And it's not that you just have to be role model. You have to inspire others also. And in doing so, it's always a betterment of the society, betterment of for your fraternity, for your specialty, and more importantly, for the safety and betterment of your patients. Because we are professionals and ultimately we are for the patients. That is what is mainly meant for all these motivational, inspiring, and dedicated lectures or dedicated webinars or whatever we read in the books, what we practice. Ultimately, the patient safety. Tomorrow, if I have to save a patient, I have to get a patient operated. Suppose I am getting operated. I want to be operated with a person who's a good mentor, who's a good teacher,
Yes.
who's a good person, who's a selfless person, who will give everything to me. Not just skill, just not knowledge. He has to be on all aspect, has to be with me. I have to trust him. That's more important.
So empathy is also very important, is it, sir? Empathy and
Yeah,
sacrifice.
empathy and sympathy, both, man.
Yes,
Empathy
sir.
and
Yes.
sympathy. These are the part and parcel of anesthesiologist and intensivist. Ma'am, I can see a question there in the chat box by Anil Kumar Paudhary, our secretary from Kakinada. Sir, apart from clinical and academic mentorship, what type of mentorship would you need to prepare anesthesiologists for administrative and leadership position in a hospital and association? So he is asking for himself. Anil, I can understand. He is doing a good job, a good job as a secretary of Kakinada, and is doing a wonderful job. He's learning the ways. But for the administrative and leadership role, Anil, what I can suggest you is never be in a hurry. It comes with your leadership. It comes with your everyday conduct. It comes with your qualities, which I described during this talk. You have to be patient because the patience is the key to success to all these type of positions. You have to build a trust and faith in the people around you. You don't have to butter the people. You have to make a trustworthy relationship with everyone. People should believe that you are a man of substance or a woman of substance, that you will handle these situations. You can handle any type of situation rather. So that is the way to go beyond your current position as an administrator or as a leader in any job, whether it's a government or it's a government job. Many times, always say that it's always a sifarish which requires or something like money which requires. But I think in the private and the corporate hospitals, it is your ability, your merit which is counted. So, Anil, I think you will be doing a wonderful job. You have asked a very right question, and I think I am able to answer. If I'm still not able to answer it completely, so I can discuss it again when you meet me personally. The next is Dr. Vanilla Kopati. Very enlightening and inspirational topic delivery, sir. Thank you. Yeah, thank you only. Thank you, madam. Thank you very much. Any other question from Dr. Praveen, sir?
No, no more questions, sir.
Why? I think you want to end this
It was,
now. I think it's it's
no,
almost
sir.
1 hour 22 minutes.
We have been joined by Dr. Madhuri Kurdi madam and Ridhima Sharma
Yeah,
madam
yeah.
also,
I think
sir.
Madhuri, Dr.
Little,
Ridhima, Dr. Arun Pandey, another leader, Dr. Shivani Photedar, Dr. Vignesh. I think they should be, but Dr. Parna also, they should be asking some questions to me. I will love to answer to them actually.
Madhuri ma'am.
Good evening,
Arun,
sir. Good evening, sir.
good evening, good evening.
Sir, I was listening. Sir, watching you all, I don't have any question about mentorship. I will learn watching you all.
It's your humility
No, sir.
that you're not asking me any questions. Arun is doing very good as a secretary of Erode, a very dynamic, very, fundamentalistic down to the basics and doing all the good things for Erode Society of
So
Anesthesiologists.
thank you so much, sir. Thank you, sir.
Good, Arun, good. Keep it
Thank you,
up.
sir. Thank you so much, sir. Thank you, sir.
Yeah. Dr. Madhuri, madam, she is just like a sister to me. She's doing such a hard work, now going to be our next editor. Dr. Madhuri, unmute yourself. You're not visible.
Yeah,
Yeah.
good evening, sir. Good evening to everybody.
Good evening.
I was just taking PG exams,
Okay, still
but
going on, exam
because
going
my
on.
mentor is speaking, I
Oh, no, no, no.
no exam just finished. I have to go for dinner, but because my mentor is speaking, I made it a point to attend this
Oh,
lecture.
man. This is too
So
much
one
I'm
more
a
point which
blind.
I would like to add is
Hmm.
when it is a mentor-mentee, can you hear?
Yeah,
Am I
possible.
audible?
Very much.
Yeah. See, when there is a mentor-mentee thing, I think the as sir said, the mentee has to take everything in his or her stride. Whatever the mentor does, you have to observe very closely and go according to that. And everything cannot be said, the mentor cannot explain everything as you told. So when you work with a person, you observe closely, you start doing whatever he or she says, and when you do, you get experienced yourself. So in that, I have sir has been you have been my mentor, and I have learned so many things regarding publications and so many other issues from you. And I think I'm really proud to have you as my mentor, and I call you my publication guru.
No.
So I don't know, and age doesn't matter for becoming a mentor.
Yeah,
So
doesn't matter.
it is the respect and the the trust that matters a lot.
Yeah, true.
Nothing else.
True, that's true. It's a
Yeah.
100% truth. Age
Yeah.
doesn't define a mentor status. Age doesn't define a mentee status. So you can have any age pattern. Even I learn certain things from my kids also. So I make them they're a mentor for some time for me too also. That these are my mentor. They're teaching certain new things. So I think there's another question by Dr. Shivani Foteda that sir I wish to ask. How to identify the true seeking spirit and not to get manipulated? I think that's a very important question. As sometime during my short experience of being a mentor, I have experienced manipulation. I don't regard the same in good spirit. I think the only answer to that, Dr. Shivani, is don't get carried away. Don't get carried away what the mentee is saying to you. The mentee may be praising you. The mentee may be thinking that you are the best mentor. You are think. See, here, I think we have to be little professional. The people are always there to take advantage of you. I 99% think like that. But still we have to give a selfless service. If we see that we are getting manipulated, then either thing I think we are missing somewhere in our mentorship that we are getting manipulated. So we have to learn from we have to do introspection that why we got manipulated. That means the mentee was not really taking a mentorship from you, rather was just taking advice and maybe using you in some way or the other. I think we have to do a real introspection of ourselves that we lack somewhere, and that's our other thing. The mentee becomes the mentor to you. So you are learning something from that person. That how you get manipulated, that means you have to learn from that person. That person is more learned from you, from us rather. I'm putting you myself in your place. That person is more learned from me. That he has been able to manipulate me. And at this age of mine, although I'm not that old, but still at this age of mine, a stage of mine, I still feel that there are very youngsters who can teach me a lesson. And I take that lesson with a pinch of salt also, but that doesn't go unforgettable. I remember that, I take a lesson from that, that make me more polished, more accomplished in the coming futures. So it's not possible always, you are right, it's not possible always. We can get manipulated, but in the end, it's important that if we are getting manipulated, try to introspect, try to learn from our mistakes so that we can become better mentors in the future. That's my take on this thing. I can hear Dr. Ridhima is also there. She is another stalwart in pediatric anesthesia.
Good evening,
Dr.
sir.
Ridhima madam.
Sir, I am to like a little bit emotional to see you and Madhuri ma'am always. I just say that mentor is not the person whom you are student or guide. Mentor can be anyone, but it's very difficult for a mentor also to become somebody's mentor. For me, I will say that you are the mentor because you were my role model, and it's not that about the education. There are many things in life for us, like getting a balance in family, hospital, and to do good. There are many times when we have breakdowns and things, and mentor is a person who realize your potential beyond you. So although sometimes you are very strict mentor, but you always pulled us to, at least to me, to that level where I have never thought that I can do things. But you pulled my hand and helped me to go all the tough times and to reach where I am. So definitely for me, the mentor is very important. As Madhuri ma'am said, I am very emotional at this moment to see you and to find myself lucky to have a mentor like you.
So nice of you to have a good thoughts about me. So that's what make you feel proud. I think at the end of the day, Dr. Lakshmi Madam, Dr. Praveen sir, and Dr. Shrikant sir, and all these Durga Prasad sir also. So as said and done, I think it gives you immense feeling of satisfaction. Now, during this conversation, during this class, my wife came, my daughter came, everybody came in the room. They saw me that I am having a good communication with the laptop, not with the laptop, with the people around me. So they didn't disturb me. They know that this person, when he get in cross into that, you cannot disturb him. So that's a focus. And it's very important to involve your family into what you're doing. Without the support of your family, you will never be able to achieve whatever you want to achieve or whatever you're going to do. Make them understand in a true sense. See, all my time is yours, although I don't give them that much time. Being involved in the principalships and then the secretaryships and then the webinars, but whatever time I give them, I think that's a good enough for my side, but they see it's not good enough, but they understand this is important. And how to be a good mentor is you have to, as Dr. Ridhima rightly said, a balance in life. Strike a balance in life. Now, during this, before this lecture, I was having conversation with almost 18 people on the WhatsApp. And that, I think that conversation was very, very important because everybody was more importantly, uh, uh, you know, uh, attentive to their happenings in around them. Somebody is getting the ISACON's lecture, somebody getting certain things, somebody and other things. So many things were going to happen at the same time, and somebody getting an award, somebody not getting an award. So all these things, messages were coming, and I was replying to them. So overall, I think in anesthesiology, it's such a good branch. We have got mentors at every stage. We have got mentors at every level. Whether you are doing a post graduation or doing a senior residency in a medical college or in a corporate hospital or in a practice also, as Dr. Durga Prasad sir said, ki bring the most experienced anesthesiologist, maybe a good earning person also. But I think the mentor should have all the qualities. If you really want to impress somebody, the communication skills, the sacrificial intent, the empathy, the sympathy as conveyed by Dr. Lakshmi Madam. So all these things are very, very important to be a part of a good mentorship. So this is something, you ask me, I will tell you that I prepared this lecture from last night till now, till today, where whatever time I got in between during my thing, 5 or 6 slides were given by Dr. Ridhima because she was a mentee to me, so she gave me slides. And apart from that, rest of I just prepared myself. I think because I don't have to prepare, it comes from inside you. When the mentorship comes from inside you, it's a really truth. Otherwise, everything remains uh, just like a superficial instinct to answer, just like an academician taking a lecture on the stage in a conference or a CME. So this is I would have loved it a more interactive way, had it been given to me the opportunity. I would have given a link to Dr. Praveen, sir, about where we could
That,
have got a direct people linked with the Zoom link as a together
yes, sir.
link for a more interactive session.
Next.
I think I've made a justice to it, or whatever has been bestowed
Yes,
upon to me.
it was very much inspiring, sir. Very much inspiring. Everyone is involved. Still, we don't want to leave.
No, that is a very wrong statement. Everybody wants to leave. That's a, I know the truth actually, not Praveen.
No, sir.
No, sir, we learned so many things from you, sir, from this lecture especially. We
Why
learned so
even
many
I
points
learned.
regarding this mentorship, sir.
Yeah, ma'am, I think I am still a learner in this stage. I am still
No, sir, no, sir. We learned so many things, sir. We don't know so many things that they are in the mentorship,
yeah, ma'am.
especially sacrifice, selflessness, all these things.
This is very important, ma'am. Very, very important part in life. Very important part, ma'am. You have to have a large heart. At least now I
Yes,
have got a
sir.
large heart, much larger heart after the CABG. I've got a much larger heart. But not a hypertrophied heart,
Exactly.
but a large heart. Yeah. So, final comments by
There
Dr.
are,
Praveen, and then we close.
yes, sir. Sir, Kuchal Babu sir and Durga Prasad madam, can we close, ma'am?
Yeah.
Yes,
Thank you. It's a wonderful
Yes.
session. Thank you.
Yes.
Okay.
Yes, it was wonderful and a very much inspiring session, sir. May I request our city branch treasurer, Srikanth Bachu, to deliver a vote of thanks and close the session.
Yeah.
Thank you, sir. So at the outset, I would like to thank our speaker for today's meeting, our Honorary Secretary for ISA National, Dr. Sukminder Singh Bajwa, sir, for taking his time out despite his busy schedule and family commitments and delivering a wonderful lecture on mentorship in anesthesiology. So your insights have been very inspirational and thought-provoking for both the consultants and postgraduates alike, sir. Thank you once again for the enlightening 1 hour of your lecture and followed up with a very wonderful discussion by various leaders of ISA national and state level. And we sincerely thank our moderators for the session, whose clinical experience and knowledge added value to the evening. Dr. V. Kuchel Babu, sir, past president ISA national, Dr. Durga Prasad, sir, he's president-elect for ISAP, and Dr. K. Sri Lakshmi, madam, professor and HOD. And we thank all the ISA national and state level leaders who have joined the meeting and have added value to the wonderful discussion post the lecture. We thank ISA Visakhapatnam President Dr. K. Aparanji Madam and Honorary Secretary Dr. M. Praveen Kumar Sir for arranging this lovely gathering and an insightful session, and other senior members of ISA Visakhapatnam and postgraduate students who have attended the webinar and made it an evening to remember. We finally thank the team Clarinet for seamless conduct of the webinar with no technical glitches. Thank you for the evening. Thank you, sir.
Thank you, sir. Thank you so much, everyone, for giving us the
Thank you,
opportunity.
everyone. Thank you, everyone. And good night and long live ISA.
Long live ISA.
Long live ISA.
Long live ISS, sir. Thank you, sir.
Thank you. Good night to all of you.